When the Grand Princess cruise ship docked in Oakland, California in early March, carrying passengers and crew infected with coronavirus, Eileen White faced a daunting task. White is the director of wastewater for the utility that serves 685,000 households in San Francisco's East Bay area.
They came into the port of Oakland with a cruise ship full of waste, and they needed to get rid of it. And so we effectively treated, some of the first coronavirus sewage.
Detecting the virus in sewage is a necessary step toward effectively destroying it. Soon it became clear that detection might be useful in other ways, too.
Early on, we were approached by a number of universities. Would we want to, help be part of the process and trying to figure out how sewage could be a useful tool as an early indicator of the presence of coronavirus in the community versus waiting for people to show up in the hospital.
Patient testing on a scale necessary to control the virus has been hampered for many reasons. Not everyone is getting tested, but everyone uses the bathroom.
You're seeing in the sewage before people are really showing the symptoms, days and weeks before.
White's team is collecting samples each week and sending them to multiple labs, including the Nelson Lab at the University of California, Berkeley.
We're really interested in trends of increasing or decreasing infections, and that would help guide decision-making.
But getting useful data from raw sewage also has many challenges.
There's a lot of things that make wastewater complicated, right? So it's not just poop and pee and wastewater, it's also rainwater and laundry water and things that vary with time. And so that will affect how dilute the virus is in the sample, like how much we can detect.
Wastewater epidemiologists have successfully tracked polio and Ebola, but the scale of the COVID-19 crisis is spurring an unprecedented rapid response. An international alliance of over 400 researchers is collaborating weekly on methods and standards. Massachusetts-based BioBot Analytics currently analyzes wastewater samples from 41 states in the U.S. using machine learning.
Wastewater data that you measure today is giving you an early warning indication of how many new COVID-19 cases you will see in that community about 7 days out.
This is because in the first few days of infection, people often have no symptoms and are not getting tested, but are still shedding the virus when they use the bathroom.
Wastewater gives you that window of opportunity.
Detecting outbreaks earlier can help health officials distribute resources and save lives.
The amount of value that people suddenly see in wastewater, I think, is refreshing to realize that it is this catchment of all of society and that we have a way of tracking important diseases. And I think it'll probably be used going well into the future as well.
The Nelson Lab at Berkeley plans to monitor sewage on their own campus this fall to support the university's safe reopening.